Do you know that 1.6 million new cancer cases were diagnosed in the United States and nearly 600,000 individuals are expected to die from this disease? So welcome to this lecture. Today we are going to discuss about the cancer, and cancer is called as the most common cause of death in the United States, accounting for 1 in 4 death, and we will going to discuss in this lecture. How can we define a cancer? It is defined as an uncontrolled division of abnormal cells in part of the body, or it can be defined as the malignant growth or tumor resulting from uncontrolled division of the cell. Now, the next question is why cancer develop? And if you take a look of this picture, it will explain you that it could be caused because of the chemicals, virus, or radiations. And X-rays is also responsible, or for example, radioactive radiations are also responsible for the cancer development. And actually, chemical virus, what they do, they may do mutation, and that mutation sometimes is inherited or it could be acquired from the chemical or viruses, or inherited because of the genes. And we see that which kind of genes will be affected. They mention here as oncogenes, which is responsible for suppressing the tumor, such as p53, and their expression has been declined either because of the environmental factors or inherited factors, and that is responsible for promotion of carcinogens or increasing the hormonal level. And that hormone increase we will discuss later on. This is responsible for uncontrolled cell proliferation or cell differentiation, and that is responsible for the development of primary tumor. Or in the decrease of the tumor suppressor gene, they will decrease of the apoptosis, or the alteration in the enzyme which is known as telomerase enzyme, that is responsible for development of primary tumor. So they are either natural ways because of inherited mutation from the parents, or acquired mutation. Why? Because of the chemicals, viruses, radiations. When we see the next slide, it talking about the incidence of colon cancer, and we see it is most common in the United States, especially colorectal cancer. In the dark blue is expressing the incidence of the colon cancers, and you can see it is least in Pakistan, Afghanistan, or in some of the African countries, whereas its prevalence is highest in Canada, America, in the European countries, in the Russia. It was low in China as well. But if you see in Malaysian context, it is in Malaysia, it is also a slightly higher. So that's explained the incidence of colon cancer, that how much common this cancer is. We already discussed different type of cancers in our previous subject in pathology. So please read the pathophysiology of the different kind of cancers, because every cancer have a different etiology, and we already discussed them in our previous lectures. When we talk about cancer treatment, as our topic is more specific to the treatment of the cancer, so there are 5 important things that we need to understand. Number 1 is we need to diagnose early for the early treatment, because many patients die because they already gone to the last stages of the cancer, where their uncontrolled cells already metastasize in different body organs, and at that level it is difficult to use different treatment or the patient to survive. Then the second thing which is important before starting the treatment is we need to know the cell, and we need to kill all the uncontrolled cells, because if the uncontrolled cells survive, they can still able to grow more and more, and then they can cause metastasis, or they can proliferate in different body organs. So Early diagnosis with total cell kill is very important. Then when we talk about the third point, which is talking about the combination of the therapy, the combination of therapy required multiple drug therapy. It means that it is not possible that a single drug will helpful in treating the cancer. They will be used in combination. But in this lectures, in this series of the lectures, we will discuss first individual drugs which will be used and their mechanisms and their clinical use, and then in the later on lectures we will discuss different combination chemotherapies that have been used. Then the intermittent regimen, because the important thing is that the cancer treatment when giving with these drugs, we cannot give them continuously because they having some adverse effects. Like some of drugs can cause neutropenia, and the problem is that the treatment or regimen we need to give is intermittent, not continuous, so that to recover not only the patient from the cancer but also maintain or manage his adverse effects or management of the adverse effects of the drugs. Then we also have adjuvant and neoadjuvant chemotherapies occasionally, which is the important part in the cancer treatment, because the cancer treatment not only require the drugs in combination but also require the chemotherapy uh, in both form, adjuvant and neoadjuvant chemotherapies, to have a better chance for the patient to survive. We will all discuss them in detail in our upcoming lecture, as this is the introductory lecture to understand the cancer and cancer chemotherapy. When we talk about the role of cell cycle kinetics and anti-cancer effects, we need to understand this table. This is very important. Why this is very important, we mentioned in the second point I'm going to highlight, is about total cell kill. So we need to understand that total cell kill in this table we can understand easily. First of all, we need to understand that when we are talking about the cancer, we are talking about mass of the cancer. Obviously, the cancer cell that is uncontrolled divided, it have some weight, right? So obviously the weight is very important. Like if you take a look of this dark structure, this is 1 milligram of the mass of the cancer cell. It could be increased to 1 gram, and it could be further increased to 1 kilogram of the mass. So this diagram is going to explain you that if the quantity of the uncontrolled cell increases, the person or the patient will die. So it means that if the uncontrolled cell will be more than 1 kilogram of the mass, then patient is going to die early, because on the right side you can see the time, and on the left time we're talking about tumor cell burden. We can express them in terms of logarithm. Why we express them in logarithm scale? Because it is increasing and increasing sharply. That is why we explain them in terms of the log scale, where we can see time and the tumor cell burden is very important. With the increase of the quantity or the mass of the tumor cells, the person is more likely to die early. So that is the first important thing. And if you take a look of this table, you can see wisely that this is the dotted line, and that dotted line is talking about stage where patients symptoms will start to appear. And that is the most important problem in the chemotherapy, that if you observe this thing, the patient will usually appear around 1 gram of mass. Is at this stage patient started to appear the symptoms. It means a person having 1 gram of mass will have appear the symptoms. And then if obviously you can see from 1 gram to 1 kilogram, that the movement of the tumor cell between 1 gram to 1 kilogram, the time is very short. And that is why the patients die earlier, because the time between 1 gram of mass of tumor cell to 1 kilogram of mass of tumor cell will be very shortened. And if you see below that patient which is asymptomatic, we can see that below 1 gram of mass we still have some time, but the early diagnosis is very important, because unable to diagnose on early stage leads to death. So that is very important when we're talking about the previous points. So this is the important thing that I need to share. Then if you see this, what has been written, number one, they're talking about the total of 10 raised power 9 cell is the smallest tumor burden that is physically detectable. That what I'm talking about, that at that level 1 gram of mass, or we can express in term of 10 raised power 9 cells, because we're not only talking about the mass, but we are talking about in term of tumor cell burden in term of log scale, which is 10 raised power 9. So this is very important part, because to detect below them is not possible. Patient do not have their symptoms, and then when the symptoms appear after that scale, then there is very less time to treat a patient. When we take a look of 1 gram of tumor mass, if you see the significance of a 1 gram tumor as mentioned in the blog, we are talking about that it can belong to 1 billion cells, which is equivalent to 1 gram weight of the size of the tumor. And 1 gram of the tumor will be the size just like the size of a small grape. So how can we express 1 gram of tumor? It can be expressed as like one small grape, or it can be expressed as 1 gram of tumor is equivalent to 1 billion cells. Then if we take a look of palliative chemotherapy, they're talking about two things. One is talking about this therapy is given to those patients that unable to recover, and then we are trying to survive the patient life by extending his life. So in the palliative chemotherapy, the problem is lies that 1 gram of mass that is showing in this graph is going to increase to 1 kilogram of mass, and if that mass increase to 1 kilogram, then it leads to the death. So what we are doing, or what the doctors or physicians are doing, that they are trying to delay the death, because in this case patient will not able to survive, but we can improve or increase the life of the patient, and then patient eventually die after that. Whereas when we talk about curative chemotherapy, we are using, or we are trying to cure the disease. As the name indicates, curative come from the word cure. So in this case, the 1 gram of mass, which at that level the patient have symptoms, we giving the multiple drug therapy and trying to reduce the symptoms, and are eliminating the symptom or reducing the tumor, and then with the chemotherapy, with different multiple drug regimens, with the passage of time, the mass which is equivalent to 1 gram or containing 1 billion cells decline with time, and then patient recover. So in the curative chemotherapy is more about the treatment. And when we talk about curative chemotherapy, it is also vary from patient to patient which type of cancer patient having. Like for example, if a patient having testicular carcinoma, we giving them surgery or radiation therapy to reduce the tumor burden. Whereas in case of the leukemia, we give combination of multiple drugs. So the main thing is that before starting treatment, we need to diagnose the patient properly. We need to identify which type of cancer patient having, and then we need to treat them accordingly, because some of the cancer can be eradicated by surgical removal of that tumor. And the main target of our therapy is to reduce or to kill all the cancer cells. Second thing that is very important when we talk about curative chemotherapy is about the toxic effect of the multiple drug regimen, because when we're giving drugs in combination, then we're giving different classification of drug, and they are having some toxic effects. So we not only need to treat a patient, but we also need to save the patient organs, such as to prevent from nephrotoxicity. So that is very important to understand this. In this slide, we are talking about the cell cycle, because the drug that are given, or a multiple drug regimen, actually has been given to inhibit the cell cycle of the uncontrolled cell division. So we need to understand the cell cycle. You already have studied in your previous lectures in cell biology, but I'm going to revise that. The cell cycle consists of different phases like G1 phase, S phase, and G2 phase. The G1 phase is a possible where is the process where the cell duplication started, whereas S phase the chromosomes duplicate, whereas in G2 phase there will be a double check of the chromosome that have been duplicated or that is actually responsible for removing or errors or repair if required. Then the mitosis process that we all know, and the G0 phase where the cell cycle stops. So we already discussed or you already studied in your previous lecture, so I'm not going to explain in detail. This picture just need to know because the drug acting on different cell cycles. And this is another figure of the phases of cell division. Like the G0 phase is the resting phase. G1 phase is a phase where synthesis of enzyme needed for the DNA synthesis. It is an initiation process actually. S phase where DNA will be replicated, whereas in G2 phase it prepare for the cell for the mitosis, and then mitosis will be occur. So that's the process that a normal cell cycle have. So what drug are doing? Drug are acting on different cell cycles. Like for example, bleomycin is acting on G2 phase, especially for at that section where the synthesis of the cellular components for mitosis is undergoing. So they are trying to inhibit the cellular components for the mitosis. Then vincal colloids and taxane for inhibition of mitosis. Then we have antimetabolites drug that is responsible for inhibiting the replication of DNA genome. And then we have also some drugs that are affecting on G1 phase. So let's move towards the classification of drugs. So the drug has been classified into cell cycle and cell non-specific cycle. It means some drugs are classified that are only targeting on the cell cycle specific. For example, if you see on the right side, we have vinblastine, and we have methotrexate, we have bleomycin. So they drugs, if you take a look of G1, S, and G2 and M, they are inhibiting the cell cycle at G1 phase or S phase or G2 phase or M phase. So the cell cycle specific acting on only such specific cells, on specific cell cycles. And we will going to discuss in our upcoming lecture on some of the drugs like methotrexate, bleomycin. We will discuss them in detail, and then etapsides as well. Whereas on the left side we have non-specific cell cycle, which is not related to the cell cycles, and they are responsible to kill the resting cell and the dividing cells. The most common drug is cyclophosphamide, which is come under the classification of alkylating agents. We will discuss them in detail later on. Then we have some of the other classification like drug acting on cytotoxic agents or cytotoxic drugs such as alkylating agents, antimetabolites, or natural products. We have like vincal colloids, taxane, or epipodophylotoxins. Whereas some of drugs are indirectly acting on the hormonal level, and example are corticosteroids and estrogen. We will discuss them in detail in our upcoming lectures. When we talk about the clinical presentation and diagnosis, we need to understand the 7 warning signs of the cancer, which consist of the change of the bowel habit, unusual bleeding or sudden bleeding, or for example a sore that does not heal, thickening of the lump or breast in somewhere, indigestion or difficulty in swelling, or obvious unusual change in wart or mole, or nagging cough or hoarseness. So these are the common 7 signs of cancer. But when we talk about the children, they having more effects and more signs and symptoms, because for example some of the cancers that occur in children, why? Because of the hereditary problems or genetic mutation. And like one of the example is Wilms tumor. We will discuss in detail later on. So in case of the children that having the cancer, we need to see the unexplained weight loss, the headache with vomiting, then increase of the swelling or persistent pain in bones or joints, lump or mass in the abdomen, neck, or elsewhere, development of whitish appearance in the pupil of the eye, reoccurrent fever that is not caused by the infection, excessive bruising or bleeding, or noticeable paleness or prolonged tiredness. So, in these seven warning of cancer or the eight warning sign of cancer in children, what will be the diagnostic procedures? We need to see the laboratory tests such as CBC, complete blood count. Then we need to see the lactate dehydrogenase level, LDH. We need to see the liver function, all the renal function tests. Radiological scanning consists of the CT scan, MRI, emission tomography, PET. Biopsy of the tissue or bone is required for the pathological evaluation or to identify the tumor markers or cytogenetics will be observed. The next thing we need to see is the determination or staging determination of the primary tumor size, extent of the lymph node involvement, and the presence or absence of metastasis, which is very important. And we discussed in the pathology in our previous lectures as well that we need to identify the site where the tumor exists, and we know that the tumor can be easily proliferate through the lymph nodes. So if the lymph node is involved, then sometimes we need to remove that lymph node or surgical removal of the lymph node is required. So this is very important because if the cancer cell proliferate or metastasize to different organs such as liver or in the lungs, it is very important because from the liver through hepatic portal vein it can disseminate to different organs in the brain as well. So we need to prevent the metastasis, and we need to identify that whether the metastasis occur or not. And the most frequent uh, origin or the site of the metastasis of the tumor is at brain, bone, liver, and the lungs. So we need to see these things before starting the therapy. So thank you so much for today's lecture. Hope to see you again.